on screen, not a problem. That has to be there on screen.
Okay.
Yeah. Ma'am, could you just change yourself a bit because the lighting is not as proper as what we were finding earlier.
No, he's just bringing the lighting.
Okay, okay, no issues. Then till that time, shall we
1
start?
second, in 1 minute, it will be done.
Okay, okay.
Yeah, because there, if people go up and down, it will distract you.
Okay, okay.
Because it's not a closed space, you know. That is the problem.
Got it, ma'am. No issues, ma'am. No issues. We will wait till then and then we will start.
I can open. You think this is a shade better? He's just bringing the light.
Okay, ma'am. No problem.
Yeah. So who are the audience?
Ma'am, the audience are from different specialities and GPs as well.
Sorry, I didn't hear you.
The audience are GPs and doctors belonging from different specialities also.
Okay, okay. So 4:30 I stop or it's with discussion? How is
Yes,
it?
right. Within 4:30, we will be concluding it.
Okay, with discussion.
Right, ma'am.
So 4:20 I stop?
Yes, that would.
Okay. So that 10 minutes discussion?
Yeah, perfectly fine, ma'am.
Okay, wonderful. Yeah. He's just putting the light. Just give him a second.
Sure, ma'am.
It's almost 4, no?
Yes, ma'am. 4.
Okay. முடிச்சிட்டு செல்ல now it's better?
Much better, ma'am.
Okay.
Okay, we are good to start?
Yeah.
Thank you so much, ma'am. So
Yeah.
with all your due permission, ladies and gentlemen, we are starting with the session for today. And a very good evening to one and all. This is Batul, the moderator for today's session from IJCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, ma'am needs no introduction, but yet it's our great pleasure and honor to introduce her. She's none other than the very famous and renowned dietitian, Dr. Dharani Krishnan, ma'am. Ma'am is PhD, RD, and consultant dietitian in Chennai. With ma'am's wonderful insights and with her enriching experience, we are going to talk about the topic for today, which is the role of intermittent fasting in metabolic health and weight management. So now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her for her precious talk to begin. Ma'am, over to you. Please proceed.
Thank you very much for the opportunity. It's indeed a pleasure to be here and to talk about the topic given, role of intermittent fasting in metabolic health and weight management. Lot of people want to do intermittent fasting, but that has to be done in the right way, and that's very, very important. We'll see that as we go. So, what is fasting? Fasting is something that we deprive of some foods or for specifically for experimental or medical reasons or religious reasons. Fasting is willful refrainment from eating for a period of time, and it's physiological. So, what is intermittent? What is the definition of intermittent? It's occurring at irregular intervals, not continuously or steady, stopping, starting repeatedly, or with periods in between. The actual word today for intermittent fasting is called time restricted eating, which means you choose certain times when you want to eat and certain hours of the day when you do not eat. So this is intermittent fasting, where ideally for 8 hours you are not, you're just eating for 8 hours in a day out of the 24 hours, and 16 hours you're fasting. But there are many types. This is the most common, which we'll be discussing in detail, but there are many, many types. So in 16 hours, you're fasting 16 hours and you can eat in 8 hours, and how you're going to eat is very, very important. And skipping breakfast is not a great thing at all, which a lot of people really want to do, but that's not the right way of doing the 16/8 fasting. You can plan an early dinner by 6 p.m. and open your fast next day by 10 a.m. But ideally, it would be 4 p.m. to the next 16 hours, which will be around 8 a.m. So 4 p.m. to 4 p.m. will be 12 hours plus 4 hours. So 8 a.m. would be the correct time to start. So it's between 8 a.m. and 4 p.m. There are other types where eat, stop, and eat is there, where it involves a 24-hour fast for once or twice a week, and the rest of the days they're eating normally breakfast, lunch, and dinner. Then there's a 5 is to 2 day diet. During the 2 day of the week, you consume very low calories, which is 500 or 600 calories, and the rest of the day you can take it normal. There's a weekly 1 day fasting where 24-hour only water. But believe me, only 1 day you should do this, not more than that, because it's not good for health. Because I met yesterday who said that a young 30-year-old is on a water fast, taking only water, and they can quickly go into deficiencies. And God forbid, if their immunity was low before they started fasting, they can immediately get into any type of infection. So beware, don't do this. Only water fasting. If you do also, it's just for a day. Now, fast mimicking diet where once per month, 120-hour, a low calorie, non fasting ketogenic diet. This is a non fasting regimen allowing small maximum amounts of macronutrients. Then there's a 10-day juice fast, irregular frequency, 240 hours fruit juices or broths are consumed during the fasting period, but no solid foods. So that would be almost for 10 days. Other regimens varied many possible frequency timing based approaches are there. So we are going to now discuss the 16/8 fasting. This is the most common one, and you fast for 16 hours and noon to 8 p.m. by skipping breakfast. This is not right way to do. Right way is to start your breakfast around 8 or 9 a.m. and 8 hour period you can take food, and after that you fast for 16 hours. Better results have seen when they start eating breakfast at 8 a.m. and stop by 4 p.m. The eat stop eat is the 24-hour fast once or twice a week, not eating anything from dinner to dinner the next day. So it's almost 24 hours that they fast. 5 to 2, 2 days, they do a very low calorie diet. 6/18 fast has a lot of research around it. Evidence is accumulating that eating in a 6 hour period and fasting for 18 hours can trigger a metabolic switch from glucose based to ketone based energy. And that is very useful in many, many things. So, what happens? Stress, resistance, longevity comes into play. What goes down from the body, diseases, even some types of cancer which are related to obesity, they can be controlled by this type of fasting. But what is the issues? If you don't fast properly, in the 16 hours, we give two meals at 8 a.m. and 4 p.m. And you have a snack midway, which will be around 12 noon. So you have to take enough protein and vegetables so that you do not have muscle loss. And you should have enough vegetables, which has to be taken in the 2 times that you eat. And it does not mean that 8 hours means you eat every hour of the day. That's a wrong thing. So you have to eat right. You have to take first a clinical examination whether you're fit for this type of fasting. If you have acidity, if you're pregnant, if you're lactating, you should not take this. And if you have some kind of treatment going on, you should not take this kind of fast. Only normal people can take. And better to get a clinician's advice and then also get a dietitian's advice who will prepare a diet proper for you. Muscle loss should not happen. It should have, the weight loss that happens should be from body fat. The human growth hormone is triggered, signals your brain to save energy, and harder to lose weight if things like this happen. So, what are the advantages? The metabolic switch happens. Glycogen stores in the liver are depleted, generally 12 hours after the cessation of the food intake. Adipose tissue lipolysis increases to produce more fatty acids and glycerol, which are used for energy. The free fatty acids are transported to the liver, where they are oxidized to beta hydroxybutyrate and acetoacetate, and they are converted to energy through beta oxidation. So, intermittent fasting in cardiovascular disease, what they found out is weight loss and reduction of inflammation has many potential long term benefits to prevent cardiovascular disease. Advantages: it improves weight loss, it enhances cardiovascular health, overweight and obese individuals with type 2 diabetes. It's very useful. This type of intervention is cost effective and associated with low risk of adverse events. Insulin resistance today is the main cause of type 2 diabetes. So it improves with caloric restriction. Insulin resistant causes increased inflammatory state, including elevated C reactive protein and decreased adenopectin, lead to increased inflammation, which is the root cause of all metabolic diseases, whether it's diabetes, cardiac disease, cancer, obesity, and so on. Low density lipoprotein particle size causes CAD. So all these are improved, and that's wonderful. Insulin induces adipose tissue growth. There is less propensity to weight gain and potentially even weight loss. So once insulin resistance is gone, most of the problems in your body are gone. The observation population studies have shown cardiovascular and metabolic benefits. Prospective clinical trials have shown HbA1c reduction and non-inferior to calorie restriction. So the effect of intermittent fasting compared with continuous energy restricted diet on glycemic control in patients was studied, and this is what they found. So the role low calorie diets in intermittent fasting is in treatment of obesity and type 2 diabetes. Therapeutic use of intermittent fasting for people with type 2 diabetes as an alternative to insulin. So these are the advantages, and one can really take all these advantages. Now, when we talk about, one second, let me make this small. Yeah. When we talk about what are the myths that come through, that patient characteristics, hypertension, comorbidities, all this are not reduced, is what people are saying. But actually, once all of your thing works right, all of this can help. So changes that happened where HbA1c was reduced and so many other things, even metformin was reduced and A1C was reduced. So these were the A1C readings of people who were fasting from almost A1C reading, which was 10 and above, it went down to 6 and above. And after fasting, the A1C reduced beautifully from 7.2 to 6.2. Patient 3, it came down, but it went up a little after that. If you see, from 6.3 came to 5.9, but it went up and stabilized at 6.2. So, what are the learning points? You have to be medically supervised. You can help in reversing or remission in diabetes. Therapeutic fasting is very important, but you need to take your blood work regularly and you need a doctor and dietitian on board. Now, early time restricted feeding improves insulin sensitivity, blood pressure, and oxidative stress, even without weight loss in men with pre-diabetes. So, what is the best way? Avoid sugars and refined sugars because a lot of people think I'm fasting so I can eat anything. Believe me, maybe 6 years ago, before Corona, I had gone to Gujarat during Navratri. There was a list of foods which said fasting foods and a list of food which says feasting foods. And fasting foods were actually higher calorie than the regular foods. So beware that fasting in our country means people think they can eat anything and everything. So you have to avoid sugars and refined grains, replace with fruits, vegetables, dals, whole pulses, whole grains. Let your body burn fat between meals. Don't snack. Be active throughout the day. Because you're fasting, you don't have to lie down or do anything like that. Consider a simple form of intermittent fasting where you limit the hours of the day. If you're not able to do 16 hours together, you start with 12 and then move further. But you have to start your day early and avoid snacking between meals. The risk is hypoglycemia if you're on insulin. So it's not advisable unless you have your doctor on board who can manage your medication according to your blood levels. Protein malnutrition if you don't take enough protein. Vitamin and mineral malnutrition if you're not taking whole foods. Weakness if you're not taking any of the important proteins or micronutrients. Excess hunger pangs, this can be handled initially by taking warm water and dehydration if you're not taking enough water. People who should not do intermittent fasting, pregnant, lactating women, young children, very old people, those with immunodeficiency, and those who are on immunosuppressant medications. Eating disorders, dementia, they should not take brain injury, they should not do fasting. Acidity and gastroesophageal or GERD as we call it, those who have that disease should not do this fasting. So, how do you manage intermittent fasting? Guidance from a medical practitioner and a registered dietitian, attention to medication adjustment, frequency of glucose monitoring, fluid intake. The risk of hypoglycemia is low, and no additional would be routinely recommended during fasting for those not on insulin. But to take your blood sugars is not wrong. People on sulfonylurea insulin need special attention. This testing could be as often as every 2 hours if the patient is on insulin, or put a CGM, which helps and you can see it on the sensor yourself. Encouraged to use personal continuous glucose monitoring systems. Clinical management of intermittent fasting with diabetes. During the use of fasting, proper medication, adjustment of self monitoring of glucose levels, intermittent fasting is encouraged. A case study of one patient who did intermittent fasting. She was 68 years old and she wanted to achieve a lot because, she was 68 kg in weight. And this was the benefit of intermittent fasting, where we'll go through it. These were the medicines. It was changed to 1 milligram from 2 milligram and changed to 1 time a day instead of twice a day. Client wanted to follow a 10-hour eating period because 14-hour every day of the week was working for her. So she did it. And diet followed was tea, then some protein with fruit. Then because she is vegetarian, it was again protein and dal with vegetables and curd and tea and whole pulses. The calories was around 1035. 100 grams carbohydrate, 50 grams protein, 48 grams fat, And these were the percentages of the macronutrients. Assessing the diet, the RDA of zero point 0.6 per kg body weight, which has been introduced, 50 grams is fine, can improve in vegetarian diet with mushroom and soy. Always there are chances to work better with the diet. Resistance exercise was used so that there is no loss of muscle. So, way forward, long term benefits of fasting, including cardiovascular risk reduction. You know, we are the capital of cardiac disease. So, if we can reduce this, we are helping our country in a big way. Fully studied and elucidated, especially in humans. Medication adjustment is important. Self monitoring of glucose levels is very important. It can be encouraged and safely implemented among people with diabetes. Thank you very much for the opportunity. I hand over to the chairperson so that any questions I am happy to answer.
Thank you so much, ma'am. Thank you for your wonderful talk that you have shared on our platform and for making our viewers understand about this particular topic, which was so important. Thank you so much for that. Moving ahead with the question answers round, I would request all our viewers to drop down their questions in the comment box if they have any, so that we can take those questions from ma'am. Till the time we have got a lot of feedbacks related to the talk. They have really loved and enjoyed your talk, ma'am, and they're looking forward to hear more about it from you. Moving ahead with the first question that we have received, and the question is that what is the golden rule of intermittent fasting? And the conception, or is it called a myth or misconception, that with intermittent fasting, people might feel weak or unhealthy?
No, see, first, if it's done by normal people, there's no problem at all. They can do it beautifully as long as they don't have acidity. The main rule is start early in the day. If you start your breakfast at 8 and you stop by 4 p.m., research says the achievements are much better. But if you want to push it, only up to 10 a.m., not further to that, because only then it works well. Otherwise, 10 a.m. to 6 p.m. will be the slot where you eat. The mistake people do are they tend to eat every hour of the 8 hour, and they think because they are fasting, they can eat anything. That is not what it should be done. As I showed you the diet, it has to be done with two major meals and one snack and be done with it. That's the way to do it. And feeling tired initially, 1 or 2 days, you may feel tired. But after that, once your metabolism changes to using your fat cells and fat for metabolism, will be perfectly all right. There will be no problem.
Thank you so much, ma'am. Moving ahead with the other question. And the other question is related to which meal is best to skip for intermittent fasting?
Sorry, can you repeat it?
Which meal is best to skip for intermittent fasting?
Best to skip is dinner because that is the time you get the full and you're awake still. Like if you stop by 4 or 5 p.m., you're still awake for a few more hours. And that's the good way of fasting. Better not to skip breakfast.
Thank you so much, ma'am. Thank you for answering that question. Moving ahead with the other question. And the other question is, like when one starts with intermittent fasting and continues for a long period of time, they find relatively their body undergoes different kind of changes. So in what kind of conditions or what kind of signals, if body gives, then a person should stop intermittent fasting or should take a break from it? So what are those signals that one should rely on or one should take a note of it?
See, if you're diabetic, watch your sugars. If it goes very low, then you have to change your diet so that it doesn't dip. But even further, if it dips, it's time to stop. If you're getting frequent headaches or some symptoms which are there very, very strongly, then it is better to consult your dietitian and medical doctor to find out whether it's time to stop the fasting. If you're acidic or you have become acidic after starting the fasting, then it's time to stop.
Thank you so much, ma'am. Thank you for answering that question and all the other questions asked by our viewers and for making them understand about the topic in such a better manner. Thank you so much for doing that. And also, I would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session and putting across such interesting questions to us. I would also like to thank you, ma'am, for taking out your valuable time and for being here at our platform and sharing such wonderful insights with us. Thank you so much, ma'am. Before we conclude, any last take-home message from your end?
Sorry?
Before we conclude, any last take-home message from your end, ma'am?
I'm sorry, I can't hear because there's a lot of
Before
rain out here. A
before we
little
conclude,
louder, please.
yeah. Before we conclude, ma'am, any last take-home message from your end?
Yeah, last take home message is don't get scared. Please try intermittent fasting. It's a great way to avoid so many diseases and it can be done. But if you're diabetic, remember you have a triangle yourself, the doctor, and dietitian to continue with the fasting till it gets, stabilized. Thank you very much for the opportunity.